Question 1. A 72-year-old client with a history of heart failure presents with shortness of breath, crackles in both lung bases, and 3+ pitting edema. The vital signs are BP 168/92 mmHg, HR 110 BPM, RR 28 per minute, SpO2 88% on room air. Which action should the nurse take first? A. Administer 4-furosemide. B. Apply oxygen via nasal cannula. C. Elevate the client's legs. D. Obtain a chest X-ray. Answer: B. Apply oxygen via nasal cannula. Rationale: the client is hypoxic, SpO2 88%, and in respiratory distress. According to ABC prioritization, airway and breathing take precedence. Oxygen should be applied immediately before other interventions. Strategy: when oxygen saturation is below 90%, prioritize oxygen first before medications or diagnostics. Question 2. A postoperative client 6 hours after abdominal surgery reports sudden shortness of breath and chest pain. The client is anxious, HR 122 BPM, RR 30 per minute, SpO2 90% on 2L oxygen. What is the priority nursing action? A. Increase oxygen flow rate. B. Notify the healthcare provider. C. Place the client in high Fowler's position. D. Prepare for CT angiography. Answer: C. Place the client in high Fowler's position. Rationale: suspected pulmonary embolism. Immediate intervention is to optimize ventilation. Positioning improves lung expansion while further interventions are prepared. Strategy: in respiratory emergencies, first improve oxygenation and positioning before calling or preparing tests. Question 3. A client with diabetic ketoacidosis, DKA, has a blood glucose of 540 mg per deciliter, potassium 3.2 milliequivalent/L, and arterial pH 7.25. Which order should the nurse question? A. Start 4 insulin infusion. B. Administer potassium replacement. C. Initiate 4 normal saline. D. Monitor cardiac rhythm. Answer: A. Start 4 insulin infusion. Rationale: potassium is low, 3.2. Insulin will shift potassium into cells and worsen hypokalemia, risking lethal arrhythmias. Potassium must be corrected first. Strategy: in DKA, always check potassium before starting insulin. Question 4. A client receiving blood transfusion develops fever, chills, and lower back pain after 15 minutes. What is the nurse's first action? A. Slow the transfusion rate. B. Stop the transfusion. C. Administer acetaminophen. D. Notify the provider. Answer: B. Stop the transfusion. Rationale: these are signs of acute hemolytic reaction. The transfusion must be stopped immediately to prevent further hemolysis. Strategy: any suspected transfusion reaction equals stop first. Question 5. A client with head trauma has unequal pupils and decreasing level of consciousness. What does this indicate? A. Hypoglycemia. B. Increased intracranial pressure. C. Shock. D. Meningitis. Answer: B. Increased intracranial pressure. Rationale: unequal pupils and declining LOC are classic signs of ICP elevation and possible brain herniation. Strategy: neurochange plus pupil change equals think ICP. Question 6. A client with COPD has ABG results, pH 7.32, PaCO2 55 mm of mercury, HCO3 29 milliequivalent/L. How should the nurse interpret this? A. Respiratory acidosis with compensation. B. Metabolic alkalosis. C. Respiratory alkalosis. D. Uncompensated acidosis. Answer: A. Respiratory acidosis with compensation. Rationale: low pH, acidic, high CO2, respiratory cause, elevated bicarbonate, renal compensation. Strategy: match pH with CO2 first to identify respiratory origin. Question 7. A client with sepsis has BP 84/50 mmHg after fluid bolus. What medication is expected next? A. Dopamine. B. Norepinephrine. C. Metoprolol. D. Furosemide. Answer: B. Norepinephrine. Rationale: norepinephrine is first-line vasopressor for septic shock to restore perfusion. Strategy: septic shock plus hypotension after fluids equals vasopressor, norepinephrine. Question 8. A client taking warfarin has 6.5 Indian rupees. What is the priority? A. Give vitamin K. B. Administer heparin. C. Continue dose. D. Encourage leafy vegetables. Answer: A. Give vitamin K. Rationale: 6.5 Indian rupees is dangerously high. Risk of bleeding is significant. Vitamin K reverses warfarin effects. Strategy: high INR equals bleeding risk equals reverse with vitamin K. Question 9. A pregnant client at 34 weeks reports painless bright red vaginal bleeding. What is the suspected condition? A. Placenta previa. B. Placental abruption. C. Ectopic pregnancy. D. Uterine rupture. Answer: A. Placenta previa. Rationale: painless bright red bleeding in third trimester indicates placenta previa. Strategy: painful equals abruption. Painless equals previa. Question 10. A client with chest pain has ST elevation on ECG. What does this indicate? A. Stable angina. B. STEMI. C. STEMI. D. Pericarditis. Answer: C. STEMI. Rationale: ST elevation indicates full-thickness myocardial infarction requiring immediate reperfusion. Strategy: ST elevation equals activate cath lab. Question 11. A client 24 hours after total hip replacement suddenly develops shortness of breath and chest pain. The nurse suspects fat embolism. Which assessment finding supports this? A. Petechiae on chest. B. Bradycardia. C. Hypertension. D. Cool clammy skin. Answer: A. Petechiae on chest. Rationale: fat embolism syndrome presents with respiratory distress, neurological changes, and petechial rash on chest/axilla. Strategy: long bone surgery plus petechiae plus respiratory distress equals fat embolism. Question 12. A client with Addison's disease presents with hypotension, hyperkalemia, and weakness. What medication should be anticipated? A. Insulin. B. Fludrocortisone. C. Furosemide. D. Methimazole. Answer: B. Fludrocortisone. Rationale: Addison's disease is adrenal insufficiency. Mineralocorticoid replacement, fludrocortisone, corrects hypotension and hyperkalemia. Strategy: Addison's equals low cortisol/aldosterone replace steroids. Question 13. A client with chest trauma has tracheal deviation to the left, absent breath sounds on the right, and severe dyspnea. What is the priority? A. Chest X-ray. B. Needle decompression. C. Oxygen 2L nasal cannula. D. Pain medication. Answer: B. Needle decompression. Rationale: these are classic signs of tension pneumothorax. Immediate needle decompression is life-saving. Strategy: tracheal deviation equals treat immediately, no waiting for X-ray. Question 14. A client receiving magnesium sulfate for preeclampsia has RR8 per minute and absent reflexes. What is the nurse's first action? A. Stop magnesium infusion. B. Call the provider. C. Administer calcium gluconate. D. Increase 4 fluids. Answer: A. Stop magnesium infusion. Rationale: signs of magnesium toxicity include respiratory depression and absent reflexes. Stop infusion immediately. Antidote: calcium gluconate, follows. Strategy: toxic med? Stop first, then antidote. Question 15. A burn client, rule of 9's 40% TBSA, is 8 hours post-injury. Urine output is 15 milliliters per hour. What is the priority? A. Reduce fluids. B. Increase 4 fluids. C. Insert Foley catheter. D. Check temperature. Answer: B. Increase 4 fluids. Rationale: low urine output indicates inadequate perfusion. Burn resuscitation requires aggressive fluids to maintain greater than or equal to 30 milliliters per hour. Strategy: burns plus low UO equals not enough fluid. Question 16. A client with atrial fibrillation suddenly develops right-sided weakness and slurred speech. What is suspected? A. Hypoglycemia. B. Stroke. C. Seizure. D. ME. Answer: B. Stroke. Rationale: atrial fibrillation increases risk of embolic stroke due to clot formation in atria. Strategy: AFib plus neurodeficit equals embolic stroke. Question 17. A client on heparin infusion has APTT of 120 seconds. What action should the nurse take? A. Increase infusion. B. Decrease infusion. C. Stop infusion. D. Administer warfarin. Answer: C. Stop infusion. Rationale: APTT is critically high, therapeutic is 60 to 80 seconds. Risk of bleeding is significant. Strategy: very high APTT equals hold heparin. Question 18. A client with hyperkalemia has peaked T waves on ECG. What medication should be given first? A. Sodium polystyrene. B. Regular insulin with dextrose. C. Calcium gluconate. D. furosemide. Answer: C. Calcium gluconate. Rationale: calcium stabilizes cardiac membrane and prevents arrhythmias. It does not lower potassium but protects the heart immediately. Strategy: ECG changes? Protect heart first. Question 19. A client with acute pancreatitis reports severe epigastric pain radiating to the back. What lab is expected elevated? A. Troponin. B. Lipase. C. ALT. D. Creatinine. Answer: B. Lipase. Rationale: lipase is most specific for pancreatitis and remains elevated longer than amylase. Strategy: pancreatitis equals lipase high. Question 20. A client with meningitis is placed on droplet precautions. What PPE is required? A. Gloves only. B. N95 respirator. C. Surgical mask. D. Gown only. Answer: C. Surgical mask. Rationale: meningitis requires droplet precautions. Surgical mask protects from respiratory droplets. Strategy: droplet equals mask within 3 feet. Question 21. A client with Graves' disease has fever 104 degrees Fahrenheit, HR 150 BPM, agitation, and confusion. What is suspected? A. Myxedema coma. B. Thyroid storm. C. Sepsis. D. Panic attack. Answer: B. Thyroid storm. Rationale: hyperthermia, tachycardia, and CNS symptoms in hyperthyroid patient indicate thyroid storm, a life-threatening emergency. Strategy: hyperthyroid plus very high fever equals storm. Question 22. A client with liver cirrhosis has confusion and elevated ammonia levels. What medication is expected? A. Lactulose. B. Spironolactone. C. Furosemide. D. Vitamin K. Answer: A. Lactulose. Rationale: lactulose lowers ammonia by trapping it in stool and reducing absorption. Strategy: confusion in cirrhosis equals hepatic encephalopathy lactulose. Question 23. A client receiving TPA for ischemic stroke develops sudden headache and vomiting. What is the priority? A. Continue infusion. B. Stop TPA. C. Give aspirin. D. Increase 4 fluids. Answer: B. Stop TPA. Rationale: Sudden headache suggests intracranial hemorrhage. TPA must be stopped immediately. Strategy, neuro worsening during thrombolytic equals stop drug. Question 24. A postpartum client saturates 2 pads in 15 minutes. What is the priority? A. Massage fundus. B. Call provider. C. Start 4 antibiotics. D. Check temperature. Answer, A. Massage fundus. Rationale, postpartum hemorrhage is often due to uterine atony. Fundal massage is first-line immediate intervention. Strategy. Heavy bleeding postpartum equals massage first. Question 25. A client with suspected compartment syndrome reports severe pain unrelieved by opioids. What is priority? A. Elevate limb. B. Apply heat. C. Notify provider immediately. D. Reassess in 30 minutes. Answer, C. Notify provider immediately. Rationale, compartment syndrome requires emergency fasciotomy to prevent tissue necrosis. Strategy, severe pain out of proportion equals emergency. Question 26. A client with chronic kidney disease has potassium 6.8 milliequivalent/L and muscle weakness. What is priority? A. Administer potassium supplement. B. Cardiac monitoring. C. Encourage bananas. D. Restrict fluids. Answer, B. Cardiac monitoring. Rationale, severe hyperkalemia can cause fatal arrhythmias. Continuous ECG monitoring is essential. Strategy, K above 6 equals monitor heart. Question 27. A client receiving morphine becomes difficult to arouse with RR6 per minute. What medication should be given? A. Flumazenol. B. Naloxone. C. Epinephrine. D. Atropine. Answer, B. Naloxone. Rationale, naloxone reverses opioid-induced respiratory depression. Strategy, opioid overdose equals naloxone. Question 28. A client with diabetic neuropathy has a foot ulcer with foul drainage. What is priority? A. Apply heating pad. B. Tight bandage. C. Notify provider. D. Encourage ambulation. Answer, C. Notify provider. Rationale, foul drainage suggests infection. Diabetic foot infections can lead to sepsis or amputation. Strategy, diabetic ulcer plus drainage equals escalate. Question 29. A child with epiglottitis is drooling and sitting upright. What should the nurse avoid? A. Applying oxygen. B. Keeping child calm. C. Inspecting throat. D. Calling emergency team. Answer, C. Inspecting throat. Rationale, throat examination can trigger airway obstruction. Strategy, epiglottitis equals never put anything in mouth. Question 30. A client with MI reports chest pain unrelieved by nitroglycerin. What is next? A. Administer morphine. B. Give aspirin. C. Encourage rest. D. Obtain blood glucose. Answer, A. Administer morphine. Rationale, morphine reduces pain, preload, and anxiety when nitro fails. Strategy, MONA, morphine after nitro if pain persists. Question 31. A client with septic shock has BP 7840 mmHg despite fluid resuscitation. Urine output is 10 milliliters per hour. What is the priority intervention? A. Start norepinephrine infusion. B. Administer furosemide. C. Place in Trendelenburg position. D. Restrict fluids. Answer, A. Start norepinephrine infusion. Rationale, persistent hypotension after fluids indicates need for vasopressor support. Norepinephrine is first line in septic shock. Strategy, shock plus fluids failed equals vasopressor. Question 32. A client with SIAD has sodium level 118 milliequivalent/L. Which finding requires immediate action? A. Headache. B. Muscle cramps. C. Seizures. D. Nausea. Answer, C. Seizures. Rationale, severe hyponatremia can cause cerebral edema and seizures. This is life-threatening. Strategy, sodium less than 120 plus neurosymptoms equals emergency. Question 33. A client 2 days post-thyroidectomy develops tingling around the mouth and muscle spasms. What is suspected? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Thyroid storm. Answer, B. Hypocalcemia. Rationale, parathyroid damage during surgery can cause low calcium leading to tetany, Chvostek/Trousseau signs. Strategy, thyroid surgery plus tingling equals low calcium. Question 34. A client receiving TPN has blood glucose 380 mg per deciliter. What is priority? A. Stop TPN abruptly. B. Notify provider. C. Administer insulin per sliding scale. D. Increase TPN rate. Answer, C. Administer insulin per sliding scale. Rationale, hyperglycemia is common with TPN. Insulin is given to control glucose while continuing nutrition. Strategy, never abruptly stop TPN unless severe issue. Question 35. A client with asthma has silent chest and is unable to speak. What does this indicate? A. Improvement. B. Mild attack. C. Severe airway obstruction. D. Anxiety. Answer, C. Severe airway obstruction. Rationale, silent chest indicates minimal airflow, impending respiratory failure. Strategy, no wheeze plus distress equals worst sign. Question 36. A client with acute kidney injury has metabolic acidosis. Which ABG supports this? A. pH 7.30, HCO3 18. B. pH 7.50, CO2 30. C. pH 7.48, HCO3 30. D. pH 7.38, CO2 40. Answer, A. pH 7.30, HCO3 18. Rationale, low pH plus low bicarbonate equals metabolic acidosis. Strategy, match pH with HCO3 for metabolic disorders. Question 37. A client with chest tube suddenly has continuous bubbling in water seal chamber. What does this indicate? A. Normal finding. B. Air leak. C. Lung re-expansion. D. Tube obstruction. Answer, B. Air leak. Rationale, continuous bubbling indicates air leak in system requiring assessment of tubing connections. Strategy, intermittent bubbling normal, continuous not normal. Question 38. A client with hypoglycemia is unconscious and no 4 access is available. What should the nurse administer? A. Oral glucose. B. 4-dextrose. C. Glucagon IM. D. Insulin. Answer, C. Glucagon IM. Rationale, glucagon stimulates liver to release glucose when 4 access is unavailable. Strategy, no 4 plus unconscious equals glucagon. Question 39. A client with eclampsia has seizure activity. What is priority? A. Restrain client. B. Insert tongue blade. C. Protect airway. D. Give oxytocin. Answer, C. Protect airway. Rationale, during seizure, maintain airway and prevent injury. Strategy, seizure equals airway first. Question 40. A client receiving chemotherapy has WBC 1000/mm superscript 3. What precaution is priority? A. Contact precautions. B. Neutropenic precautions. C. Airborne precautions. D. Droplet precautions. Answer, B. Neutropenic precautions. Rationale, severe neutropenia increases infection risk. Protective isolation is required. Strategy, WBC low equals protect patient. Question 41. A client with abdominal aortic aneurysm reports sudden severe back pain and hypotension. What is suspected? A. Stable aneurysm. B. Rupture. C. Renal colic. D. Pancreatitis. Answer, B. Rupture. Rationale, sudden pain and hypotension indicate rupture, surgical emergency. Strategy, AAA plus hypotension equals rupture. Question 42. A client receiving digoxin has nausea and yellow vision. What should the nurse do? A. Give next dose. B. Check digoxin level. C. Increase dose. D. Administer potassium. Answer, B. Check digoxin level. Rationale, these are classic signs of digoxin toxicity. Strategy, GI symptoms plus visual halos equals toxicity. Question 43. A client with DVT develops sudden dyspnea and tachycardia. What is priority? A. Ambulate client. B. Elevate leg. C. Administer oxygen. D. Massage calf. Answer, C. Administer oxygen. Rationale, suspected pulmonary embolism. Oxygenation is priority. Strategy, ABC first in PE. Question 44. A newborn has cyanosis when crying that improves when knees are flexed to chest. What condition is suspected? A. PDA. B. Tetralogy of Fallot. C. Coarctation. D. VSD. Answer, B. Tetralogy of Fallot. Rationale, knee-chest position relieves TET spells by increasing systemic resistance. Strategy, cyanotic spells relieved by squatting equals TOF. Question 45. A client with myasthenia gravis has difficulty swallowing and weak cough. What is priority? A. Encourage fluids. B. Suction setup at bedside. C. Ambulate. D. Give sedative. Answer, B. Suction setup at bedside. Rationale, weak cough increases aspiration risk. Airway protection is priority. Strategy, MG crisis equals airway equipment ready. Question 46. A client with hypercalcemia reports weakness and constipation. What is priority intervention? A. Restrict fluids. B. Encourage hydration. C. Give calcium supplement. D. Bed rest. Answer, B. Encourage hydration. Rationale, fluids promote calcium excretion and prevent kidney stones. Strategy, high calcium equals flush it out. Question 47. A client with Crohn's disease has severe diarrhea and potassium 2.9 milliequivalent/L. What is priority? A. Administer potassium. B. Restrict fluids. C. Give laxatives. D. Encourage ambulation. Answer, A. Administer potassium. Rationale, hypokalemia can cause cardiac arrhythmias. Strategy, K. Love equals replace. Question 48. A client post-craniotomy becomes restless and BP rises with bradycardia. What is occurring? A. Shock. B. Cushing's triad. C. Sepsis. D. Hypoglycemia. Answer, B. Cushing's triad. Rationale, hypertension plus bradycardia indicate increased ICP. Strategy, opposite pulse/BP trend equals ICP. Question 49. A client receiving enoxaparin develops severe abdominal pain and hypotension. What is suspected? A. GI bleed. B. Dehydration. C. Constipation. D. Infection. Answer, A. GI bleed. Rationale, anticoagulants increase bleeding risk. Abdominal pain plus hypotension suggests internal bleeding. Strategy, anticoagulant plus instability equals bleed. Question 50. A client with anaphylaxis after penicillin injection has wheezing and hypotension. What is the first medication? A. Diphenhydramine. B. Epinephrine IM. C. Hydrocortisone. D. Albuterol. Answer, B. Epinephrine IM. Rationale: epinephrine reverses airway constriction and hypotension immediately. It is first-line treatment. Strategy: anaphylaxis equals epinephrine first.
If you survived these 50 questions under real exam pressure, then you're building the exact mindset you need to pass the Nclex. Remember, the exam is not about memorizing facts. It's about prioritizing correctly, thinking critically, and protecting your patient every single time. Go back, review the rationales, master the strategies, and train your brain to think like a safe nurse. If this helped you, like the video, share it with another future RN, and subscribe to Nclex Made Easy 91, where we turn pressure into confidence, and confidence into past results. See you in the next drill. Stay focused, stay sharp. Let's get you licensed.